For those with a serious or terminal illness or disability, Canadian courts, lawmakers, and culture say there are only two options: a slow, painful death or a quick, easy, assisted suicide. But there is a third option. Join us as we investigate the palliative care alternative and why Canadians should be choosing it. Our exploration of palliative care now turns from those who directly benefit from that care to those who provide it. After our look at the excellent support and long-term care provided at a seniors facility, we now head to Hamilton, Ontario to get another perspective, this time from a palliative caregiver.
I am Gayle Jansen van Doorn. I'm a palliative care nurse, and I work as a nurse in the residential hospice setting in palliative care. And it's very dear to my heart. I am concerned about the elderly, the fragile in our society. I think we need to speak up for them. Mm-hmm. And that dignity, that respect, that compassion goes, in all levels of life, right? The young, the frail, the elderly, the sick. My brother passed away at home. It was it was very difficult for the family. And again, I realized just how important it is to have good palliative care, that family members have the support that is necessary.
We often hear the term dying with dignity. Those who promote assisted suicide use it all the time. Gayle has a different perspective on this term.
I think dying with dignity can be done in a palliative care setting where, for example, in our hospice, we don't hasten death, but we don't prolong life. So we allow death to happen sort of as the disease progresses. I think the death with dignity can happen without the physician-assisted dying process happening, without the euthanasia process.
Even before euthanasia and assisted suicide were made legal in Canada, people would ask for it. We asked Gayle what usually drove those people to make such a request.
I think especially it's because people are afraid. There's a lot of anxiety, there's fear of suffering. So we really reassure them that we are with them every step of the way, that they will be given all the support that we can offer, medically speaking, but also emotionally speaking, that we can support also to the family. As far as the fear of suffering, we can relieve that then, like certain symptoms that do happen at the end of life that are very difficult to manage within a home setting, we are able to do in the hospice setting then with medications and just the knowledge that we have, right? So we provide that support round the clock, and that includes then that holistic support. I have heard that sometimes it is very difficult to access their family doctor if the patient's status changes, if suddenly there's maybe increased nausea or increased pain, it's the weekend, they can't get a hold of their family doctor, they can't get a hold of additional nursing support, and those can be very difficult times for the family members in the community. Whereas in the hospice setting, then we have access, direct access to a physician so that we can have orders changed right away. So there's no delay, there's no waiting, and of course that reduces the anxiety for both the patient and the family members.
Gayle's description of hospice care and the public benefit of it made us wonder whether there was enough awareness and support for it. We asked her if more can be done.
I think we need more hospices in Canada. The hospice is a beautiful balance between hospital setting and home setting. So we will receive residents, we call them residents, not patients, and we receive them sometimes from the hospital and sometimes from the home. And when we receive them from the home, it's because they are either not able to take care of themselves anymore and they live alone, or their family members, their caregivers are burning out. I tend to say to the families, you know what, now you can take off that caregiver hat. Now you can be a family member, you can be the wife, you can be the sibling, you can be the daughter. I believe that we are all created in God's image, and I think as God's image bearers, we also have to treat one another with compassion, with dignity, and with respect. And whether they are believers or not, we still have to maintain that dignity and that compassion, and I think as Canadians we're held accountable for that as well. When you look at the word hospice, the original use of hospice was set up by Christian churches for weary travelers, right? And when you think of the word palliative, it comes from the Greek paleo, to cloak, to cover. So I think St. Peter's Downtown was started by the church. It was called the home for the incurables of all things. But it's the churches that started then this idea of providing comfort to the sick and the dying. So that Christian faith is definitely coming through.